Hello, everybody. Welcome to Medicare Advantage 2025 Compliance Preview. We're happy to have everybody here. I'll just start off. I apologize for my voice. It was not on my 2025 to-dos to host a webinar with laryngitis, but we are here and I'm excited to have the conversation with you today. Luckily, you will not have to listen to me for long because I have two great guests with me, and I'll introduce them in a second. Liz, you want to move the slide forward? Awesome. Well, before we get started, I think you're probably all aware of this, but you are in listen-only mode. That is not because we don't want to hear your questions. We absolutely want to have you engaged with our speakers. And you can do so by just clicking on the Q&A icon on the bottom of your screen. So no question is a dumb question. Feel free to jump in and we'll actually take your questions as they come in. Also, our session is being recorded. So once we're done today, we will go ahead and send the recording out as well as the slides for you. So let's get to the content. We're going to start out with a year in review. So look over the last 12 months. We'll talk about what lessons were learned and then get into a compliance preview, what we can anticipate coming forward, and then talk about the alignment between compliance as well as sales and marketing in your business. So you can meet your speakers. My name is Jessica Weldon. I'm the moderator today. I've been with WEX Health for over 20 years and most recently spent my last 5 years really focused specifically on health plans, really within Medicare Advantage and Medicaid. And we've launched our products in the market, and then now I'm focusing on and leading our health plan strategy. And I've been lucky to work with John Selby and Jackie Dudley over the last several years, bouncing compliance ideas off of each other and really having some great discussions. And we're excited to bring this to the broader audience today. So with that, John, do you want to introduce yourself?
Sure thing. Thanks, Jessica. Hello, everyone. I'm John Selby. I'm the president of Rebellis Group. We are a subject matter expert model consulting firm that specializes in government programs. Most of our work the last several years has been around Medicare Advantage because of the demand, but we also do work in the ACA and the Medicaid spaces. And we're organized like a health plan would be. So we have practice areas that face off with our experts and your operational teams. Personally, I spent 30 years on the plan side of the business. I ran a general agency for a while on the distribution side. I've worked with Jackie both here at Rebellis and formerly at one of the plans that we worked at where we both wore many hats. And that will become relevant as we get into the conversation because we're going to draw on the experience that we had working with each other and how that might be able to help you all going forward. Jackie?
Thanks, John, and good afternoon, everyone. I'm Jackie Dudley, and just to add a little bit more color to what John mentioned, we have deep experience. I personally, when I left the health plan side about a year ago, I left in the capacity of heading up our product, marketing, sales, community outreach departments. But also within the health plan, I spent many years as chief compliance officer for both Medicare and Medicaid. So that was tremendously valuable experience as I moved over to the business functions and to take that learning with me. And I'm happy to be here today.
Well, thank you. Like I said, we're going to start with just kind of doing a review of what some of those compliance challenges and successes were, really to kind of figure out like what was learned and how do we take that forward in the next 12 months. So I think we can all agree that the last 12 months have been difficult in Medicare Advantage with all of the new compliance regulations being forced on us. But can you go to the next slide, Liz? I think we want to focus mostly on IRA, some of the expanded reporting requirements, as well as that more intense focus on marketing and sales, and talk about what some of those biggest compliance challenges were, and then what we learned most from them. John, I'll hand it over to you.
Sure. So we'll start with the Inflation Reduction Act, and admittedly, this really affected 2025. Had more impact than 2024, but it affected the work that we did last year in terms of bid development, benefit construct, and the financial impact that had. And we'll talk a little bit about that on the next slide. Um, the cost shift from the member, Part D cost shift from the member back to the plan, um, had all sorts of consequences, right? And on the financial side, we saw, some of the national plans intentionally look to reduce membership. And we'll talk a little bit more about maybe how the local plans grew membership beyond even their own expectations. Operationally, I think one of the areas that really stood out, at least in what we saw in the work that we do with plans, was around the Medicare prescription payment plan, and how plans had to work with their PBMs or rely on their PBMs really to operationalize that. And there are definitely some things still to come out of the IRA and even around M3P in 2026. So it will be the gift that will keep on giving to some degree. Presume that you've all seen, the implications of those things already. Have not heard much about, I think it's too soon to know how M3P is really being implemented, whether it was implemented well or not, because we're probably not seeing the volume yet, but that remains to be seen. Um, I'm gonna let Jackie talk about the expanded reporting requirements for supplemental benefits. There's both the what and sort of the how, if you will, and she can explain that.
Right. Thanks, John. So, as we hopefully all know, the supplemental benefits, when they were first part of the benefit design, especially the benefits flowing through a debit card or card program, were really off the radar, off of CMS's radar, because we weren't reporting on them. But I think that they got so popular, and there are so many dollars flowing through those cards, that CMS, of course, wants to understand more what's happening and for there to be more transparency. And so that fast forward, that brings us to now they've asked us to, report on those. Along with appeals and grievances, and they're going to learn more about them, and they're going to ask questions, and they're going to dig, and they're going to come up with maybe additional rules once they go to school on this a little bit. The piece here, though, that I think is really important is not only do plans need to figure out how to get the data, right, which means working with their card vendor, working within the plan, sending the information as required to CMS. But some of the requirements or the ask are difficult. They're new, right? And so in the industry, there could be some assumptions made, could be made by the compliance department, could be made by the legal department, could be made by the product department, and they're assuming what CMS wants or needs, right? And I would ask plans to consider being very careful here. So we should provide what CMS asks for, no more, no less, right? And if plans are asking for clarification by CMS, you should think about, as we always do, what we're asking for, right? Because maybe there's an answer that we don't want to know. So just be careful, because the more CMS gets questions and the more we provide to them, it opens the floodgates unnecessarily. We may get there anyway, but I don't think that the plans should expedite that, right? So my message is be in full compliance, absolutely. but not over compliance.
Yeah. Jackie, you and I have talked about this quite a bit, and some of the reporting asks are things that our health plan partners don't have access to that data. So we talked a lot about using default when that's available and
Yeah.
yeah, exactly. And I think this is also an opportunity, and I'm sure you guys have seen this across your health plan partners too, is this is an area where you really have to partner with your compliance team. So compliance and business really have to collaborate on what's available and then how do we give that data back to CMS?
That's right. And just if I could add, it's really a collaboration between the business and compliance. It's not it's not with the business taking information to compliance and saying, is this okay? Right.
Right.
There should be a discussion there and a healthy push and pull towards the right answer. And for example, I've had some folks talk about procedure codes. Well, they don't exist. These aren't claims, right? We're so used to reporting on claim data, but these aren't claims that are flowing through the cards. So just be careful about the terminology and the data that's pulled. I mean, eventually, this report will go through a data validation audit. We haven't reached that point yet, but it's coming. And there could be some industry findings and lessons learned coming out of that.
Right.
Thanks, Jessica.
Yeah, that's really helpful. John, you want to talk a little bit about the focus on sales and marketing?
Sure. What we saw in the Biden administration year over year was this increased scrutiny around on sales and marketing practices, and it started with really kind of a campaign that probably was intended for the non-broker TPMOs, the lead generators, but they painted it with a very broad brush. It included brokers. I'm sure you're all hearing about it locally, and the concerns around that. And then that magnifying glass just got stronger year over year during the administration, even into the preliminary rule for 26. Um, you know, we'll talk a little bit more about what's going to happen with the new administration and how that could affect things. But even if they maintain the status quo and they don't enact some of the new things that were in the proposed rule, there's still, we're at a point that we were at, I don't know, Jackie, 15 years ago, probably, in terms of
Mhm.
CMS, really zeroing in on sales and marketing practices. And
Yeah.
it's unfortunate, but it's also probably necessary, because when CMS stopped monitoring it, the industry, at least some elements of the industry, let's say, probably started to take advantage of things. So we'll see where that goes in the next administration. But at a minimum, if things stay the way they are, not everyone's thrilled with that on the distribution side.
Right. We do have one question here. So one question was, any thoughts on the best way to report total net incurred costs for plans with PM arrangements where one fee covers all 10 or more service categories?
Mm.
Um, I'm a little stumped. I admittedly, Jessica, if you could maybe send that question to us just in writing. I want to go back and look at the technical instructions before we answer that, because it could be dangerous to answer that on the fly.
Totally understand.
It's a good question.
Compliance discussions. That's a
Yeah.
totally fair answer.
Yeah,
All right, great. Do you want to move to the next slide, Liz?
sure. We're going to answer the other question that's in there. I just took a look at it. We'll answer that in a later slide.
Okay.
You want me to riff on this a little, Jess?
Yeah, I think, you know, what we learned this year is that growth isn't always good. And so you want to talk a little bit about what we saw and, you know, what plans should plan for growth and expectations.
Yeah, yeah, absolutely. So, the feedback I'm getting from most local plans that I talk to, and by local, I mean not, the big nationals, is that they grew, they reached goal, and more often than not, they significantly exceeded goal. And, there's obvious concerns around that, right? Customer facing resources, customer service, care management, things of that nature. I think I'm hearing plans that are altering, or if not, in some cases, eliminating their um, marketing campaigns for agents and other campaigns that they would run during the lockout period. Um, if they've got commercial membership, maybe they're continuing to try and cultivate the commercial members, transition them over as they retire. But the big question mark, I think, is what happens in 2026. And at a high level, I think I'm hearing people, and I believe that things will be maybe as chaotic, just in a slightly different way. So, as you're looking at current state, and we don't have a clue yet, obviously, financially, how this is going to play itself out. But aside from the member facing resources, which I'm sure, your operational and care management teams are already raising issues about, I would be most focused on risk adjustment in particular, and care, medical cost. And we know that whatever assumptions were in the bid, if you significantly exceeded your goal, those financial assumptions are going to be different, but you can trend it on a PMPM basis. So did you get a healthier population, which in turn has a lower risk adjustment score, or a sicker population, or do you have the dichotomy of my care management costs are up, but my risk score isn't improving, or isn't going to improve? So what's the balance there? It's ultimately, at the end of the day, it's all about making the financials work, because if they don't work, the plan is in jeopardy in other ways, right? Um, and then also, what's the effect going to be on the 2026 bid? So we're literally 4 months out, I think, from the date, or if not, I'm off by a day or two. We're 4 months out from the 2026 bid.
Yeah,
So, what are the assumptions that we're going to make? And then, is this going to be a retention play, right? We don't
yeah,
want to grow. We just want to manage the members we have. Well, if everyone in a market is in retention mode, what's the market going to look like? And who are the winners and losers going to be? And in this case, losers may be the plans that actually grew when they didn't want to.
yeah.
So the bid
Especially since,
process is going to be fascinating this year.
yeah, I
Yeah.
agree. Especially after seeing like the 23% switch rate last year, which was, yeah.
Yeah. Yeah.
Jackie, did you
Just
want to add anything else?
yeah, I do. So from my perspective as a person formerly responsible for product and sales in different areas, this is a great time for everyone to go back and reforecast, right? Given what we know now, when you really think about it, it can be very tactical in terms of what needs to be reforecasted, everything from financials and enrollment, what the assumptions are in the bid, as John mentioned. It could go down to, do we have enough stock in house to support the members that we didn't expect to have?
Yeah.
So this is a great time for that forecasting, and also to obviously, if there's any changes that are needed to, filter those up, especially to your financial units, to make sure that, you're on track for the rest of the year.
Yeah, good point. Good point. All right, let's want to move to the next slide. All right, so we can get into the meat of it here and talk about what's coming next. You can go to the next slide again. I think we already got a question about this, so we know
Yep.
everybody's interested. But given that we're a few weeks into the new administration, what are you seeing as new priorities? And obviously, we're it's kind of a wait and see now, but would love to hear kind of what your predictions look like.
Sure. I can start, Jackie, and then,
Sure.
I'll just hit at a high level. So, if past is prologue, Trump 2.0, we would expect to be more plan friendly than the Biden administration was. Um, we were talking about the proposed rule versus the final rule, and now we've got the communications moratorium. So that, there's no way to get any more insight. I just saw before we got on this that it looks like Kennedy is going to get approved. So, that may start to give us a little bit more information. But that lack of communication isn't a good thing, certainly, right? Um, and I would just say, right, there's at a really high level, there's maybe three options, right? One is clearly a no, which is the Trump administration continues to move in the direction of the Biden administration. That's not going to happen.
Mm.
So the other two options then become repeal or pull back on regs and restrictions, or just sort of maintain the status quo. And I'm guessing you'll see some combination of the two. Couldn't predict necessarily where that's going to happen. If the Lobbying Act if lobbyists can find a clear common message about sales and marketing in particular, then maybe they can make some inroads, but they've got to be crystal clear and surgical in this, and otherwise it'll just become letter soup. But Jackie?
Yeah, and just to bring this down to specifics, one of the areas that's being talked about right now is the enrollment form, right? A lot of plans have invested in making changes to those really important forms, and they've invested in making changes not only to the forms, but to the systems. And so, you know, what does that mean? Are we going to now get a notice to undo what we did? I don't know, right? But I think that we should be very flexible. No, and just, it comes in. If we have to change, then everyone has to change longer term. If it simplifies the form, that's a good thing. But it might cost additional money to undo what has been done so far. And that would be a good message to start to socialize in the organization rather than waiting to get a notice, right? And so I would encourage folks to do that. If it doesn't come to fruition, that's okay, but at least people won't be surprised if it does.
Yeah. We were just talking about this yesterday, but we saw the mid-year notification to members get pushed out another year. Do we anticipate that happening elsewhere? Is there anything else that you guys are hearing that could possibly get pushed out?
Let me see. I haven't personally heard of anything. I've just been hearing about things that maybe would get repealed.
Yeah. I'm looking at the last box on this slide, right? The VBID model is sunsetting, and um, the what I'm hearing out of Washington from the lobbyists is that the Trump administration it values flexibility and sort of at the members benefiting the member, we'll say. And so I don't recall off the top of my head how if the VBID model was in the proposed rule or if that was being effectuated differently. But um, you know, I don't think we're not hearing that SSBCI benefits, for example, are going to be diminished in any way. I don't know if they could sort of change course on the VBID model. I understand that was a cost, there was just cost to that, and that's the reason that was being changed. But I honestly, Jess, I think it could be this is the challenge, right? They don't have a lot of time, and they've got to make some significant choices about where they're going to place their bets, if they're going to make changes to the proposed rule or anything that's in place today. And that's why, especially with the time it's taking to get people approved and the communications moratorium, this is going to be a very challenging bid cycle.
Yeah. Yeah, especially with people planning and not knowing what the final rule
Yeah.
is yet. Um,
Yep.
Anything else that you guys would call out in the proposed rule? Anything that you think would have a big impact on plans today? Obviously,
The I
understanding that it's a proposed and not final, but
Yeah, there are a couple things that folks, if they haven't read about it, they might want to go back now and just see what's there. And again, this idea of socializing what's in the proposed rule so that folks aren't surprised that it's coming. But so the proposed rule um, includes coverage of anti-obesity drugs, right?
mhm.
um, and not only by Medicare but Medicaid. So, your pharmacy folks should know that. Um, I'm sure there are a whole other people that need to know, and finance needs to know, and but we'll see. There are going to be some AI guardrails. I would anticipate we're going to see that most likely year after year in the proposed rule as the industry becomes more sophisticated and understands the capabilities of AI. Um, that'll probably flow through the proposed rule. Um, the other piece is that for those that are in the DSNP business, um, this is, very tactical but important. Your ID cards on Medicare and Medicaid are going to have to be integrated, right?
Yeah.
I ran a DSNP. We didn't have integrated cards. We said, show your Medicaid card, keep it in your wallet, but here's your MA card. So now they're going to have to be integrated. So think about that. Your systems might need to change. Um, let's see.
Network adequacy, Jackie, the reporting on
Network
network.
adequacy. They're adding standards for example, behavioral health. So there's more and more data that plans are having to provide to CMS. And frankly, I'm a little concerned about that because we all know across the industry that CMS has been all over plans on network adequacy and accuracy, right? And networks change every second of every day. And plans are going to have to turn those files over to CMS to put on the plan finder at one point. And so, anything less than 100% accuracy is going to create an issue. And I just don't know where this is going to go. And if you think about it, if you think about this desire for CMS to have transparency in terms of networks and products and et cetera, the question is, where will that end? Will it include at some point supplemental benefits? And where is it I can get my grocery benefit from? Will that have to be put on the plan finder as well? So these are some of the things to think about. Hopefully, won't go that far, but it could.
Yeah.
One thing to add to the network piece of this, right, is because let's be honest, at any point, any second of any day within the year, data is out of order, right? It's
Yeah.
inaccurate. The question is, when does CMS decide they're going to bring that hammer down? And do they use that as a leading edge into a plan, or do they use that to sort of build a case, right? That they're seeing more institutional lack of compliance. So I think, keeping an eye on how often that comes up, when does it come up, right? That sort of thing as it relates to plans that they might take action against, will be informative early on in the process.
Very insightful. Jackie, is there anything else you wanted to add on this slide?
No, no, thanks.
Okay. All right. So we talked a little bit about VBEG going away, SSBCI possibly becoming more valuable to plans. Let's talk a little bit about the special needs market, the SNP market. John, do you want to walk us through this? I know you had
Yeah,
some thoughts on this one.
definitely. So, let's pause reality for a moment and say at some point when things sort of settle down, plans are going to want to continue to grow, right? Or they're going to want to continue to grow very surgically. And the special needs market is the place I think to look. That's what we would advise. It's also what we're seeing plans doing. And I'll jump kind of to the third bar in here, which is, part of the reason is the boomer market is maturing. And so that upward spiral that we saw for years is going to start to flatten off, and plans are going to start to look for opportunities. So the special needs market is we're already seeing growth there. This isn't a surprise, right? It's just, when does it become more of a focal point than even it is now? So you've got a couple of things going on, right? The exclusively aligned model where Medicaid and Medicare Advantage benefits or Medicare benefits are being delivered by a single carrier, is going to present opportunities, or it's going to present limitations to plans depending on whether they can comply with that. The California model shift, which we're seeing will go into effect 1/1/26, is really built on this exclusively aligned model where I hope I'm going to say this correctly, we do work out there, but it seems like largely the community-based plans that are Medi-Cal plans, Medicaid plans today in the state are being expected to implement D-SNP plans by 1/1/26. So, we're looking at other states and thinking like, okay, who are the fast followers going to be? And CalAIM is a much bigger, it's a huge initiative. This is one of the elements of that. So if you're in a state, and I'm just going to say this hypothetically, right? New York is often a fast follower of California. If I was in New York, I'm sure plans already do have, their ear to the grindstone in terms of, what's going on in Albany, but I would be listening for these sorts of things. And then, the boomer market maturing is sort of the cause of, and this is the effect. There's people are asking more about I-SNPs now. There's tremendous interest in C-SNPs. The D-SNPs have opportunity, but they also have a lot more rigor around them. And so, I personally think that if I'm a plan right now, I'm looking at my C-SNP opportunities. And part of the reasons is it's much less of a lift than a D-SNP is. You've got no state involvement. You already have members in your plan that would qualify. So you should be able to measure, for example, whether you are effectively managing the diabetic population in your plan today. And if you're not, can you figure out why, right? And it may just be focus. And then you think about, I can take these members I'm already get increased revenue for them. And all I have to do in a perfect world is keep doing what I've been doing for them and managing their care and helping them get better outcomes. That's a win-win. When it comes to the distribution of this, plans may have to start thinking differently about their distribution channels. So we use the broker example in here. Brokers that sell to sort of your mainstream MA market, those people that are aging in and switching, are not necessarily the brokers that are going to sell to a D-SNP market. And so while the company strategy and the product strategy and the financial strategy may be, let's say, to add a D-SNP product, the ramifications of that from a member services standpoint, but let's just say from a distribution standpoint, which is usually where I sit, it could be much different. And so it's not as easy as saying, oh, brokers make up 75% of our sales volume in a year. They're going to continue to do that for us in the SNP market. It is a ground game. It is much more Medicaid-like in the sales process than Medicare Advantage is. So that's a learning curve plans may have to go through. And Jackie and I have both lived through this at
Yeah.
the former plan we were at.
One comment I want to make on DSNP, because this is near and dear to my heart, this product. John is right. It is much more complicated. It's probably the most complicated product out there because you've got MA and Part D rules that are nice. They're consistent across the nation, but you've got state rules. And if, the old saying is, if you've seen one state, you've seen one state. So, you couple this national program with a state view, and even marketing materials are difficult because you've got state involvement, you have CMS involvement. The states can take a very active role. They don't allow what CMS allows and vice versa, so it can be tough, but it can be a very lucrative business for plans. And if you're either not in DSNP and want to get into it, I would encourage you to look at this. And if you are in DSNP and are just doing okay, maybe it's a good opportunity to look at the different components of what makes your DSNP successful and make some adjustments.
Yeah. Oh, this is great insight into the market and where the member growth might come for our plan partners. Any compliance like pitfalls or things that we would want to be aware of or consider if a plan's thinking about going into TSNP? And I'm sorry because I didn't prep you for that question, Jackie or John.
That's okay.
Just curious.
So,
what do you mean prep us?
Yeah. So I'm going to state the obvious. So this is the most vulnerable population, right? And CMS and the state, especially the state, is going to be all over this product. They will be all over everything. So and I don't say that to discourage you. I think it's fine that they have that level of oversight, but those are the rules of engagement, right? It's not, they will be nitpicking marketing material. They don't like certain words. I mean, it's just, you've got audits between CMS and then the state coming in, because the state will come in and do iPro audits. It's a very regulated product, but it has great opportunity. And if you can win in DSNP, then you can win in MA.
Yeah. I would just add on to that, the operational lift, right, is similar but different. But I think the focus on the model of care. So if you have a DSNP, you have to have a model of care which explains how you're going to manage the care for these members. And you update it, I believe it's every 3 years. And I learned from experience at a plan that I worked at, not with Jackie, that the folks that should have been minding the store on the model of care weren't. And we found ourselves in a mad scramble prior to the model of care needing to be resubmitted. And so never lose sight of that, whether you're getting into it, because understand whatever you put down on paper is what they're going to expect you to do. Right. So, I've seen amazing models of care, but they don't actually get followed. They just look really good on paper. So don't lose sight of the importance of that.
And John, I could be wrong. It's been a while, but I'm pretty sure that compliance with the model of care is audited by CMS. So they will look to make sure that what is articulated in writing is happening with its members.
Yeah, I believe you're right. or at least it was when I was still on the plan
Yeah.
side.
Great. I appreciate this conversation. Anything else that you guys want to add with compliance and what we expect to see, or anything else we want to hit on this topic?
No, I think we've
Yeah,
got some other
move
stuff
on.
in the future slides that are good.
Great. Can move forward. And again, any questions that you all submit, we'll take a look at and try to answer as well. I think we've teased this a little bit in several of our conversations, just the year-round alignment with compliance and collaboration. Let's move to the next slide, Liz. So I know that we definitely have worked with our plan partners to build their compliance strategy and kind of talk about what that looks like for their overall product throughout the year. And I think you guys have as well. So do you want to share with some of your examples here?
Yeah, I'll let Jackie touch on this.
Sure. So this slide is kind of near and dear to my heart. And I really do think that this is a best practice, but the business, and in this case, sales and marketing product, really should be in lockstep with your compliance department. It should not be an adversarial relationship. It shouldn't be a mother may I relationship. It should just be a good relationship for the good of growing the business and meeting the goals. And the business can't do that with compliance, and compliance can't do what they need to do without the business. What we have found when I was on that plan side is that a couple of times a year, and really the timing is such that it'd be like first quarter, just sit down with the compliance department. And I don't mean with the compliance officer, I mean everybody in the compliance department, because everyone has a different role and they need to understand what is happening on the business side. But to sit down and share the strategy and share what we're thinking about filing in the bid, right? And let those folks ask questions. The more they understand, the more they can help the business make sure that things are okay with CMS. And then the next time is to meet would be after the bid is filed, because things change. And you'll want to make sure that your compliance team is in lockstep with what was filed in the bid and why, right? Again, so that you can work in partnership. And that also helps your compliance group when they're interacting with CMS to really make CMS understand that the compliance group knows what's going on with the products. It's not happening in a black hole somewhere else in the organization. And it'll help the compliance team move forward on certain things, making sure that the regulators are comfortable, the marketing material is getting approved because everyone understands what the plan is doing. Some of you may be required once a year to present on your product strategy. I know that was happening at the New York regional office. And it's now required of all plans. One plan started it and CMS liked it. Now it's required of all the plans in that region. But again, that's another opportunity to share the strategy. Now, it might not be as deep as what you do internally, but certainly to present what is publicly available on Plan Finder and et cetera. Just to make sure that CMS and compliance are all on the same page. The better they understand what's happening, the better it is for sales, marketing, and product to move through the agenda and meet those goals.
Yeah, I think some of the, worst case scenarios when there's a surprise mid-year to compliance. So I like your suggestion. I think understanding the intent of the benefits always helps so much when we're talking with our plans and their compliance teams.
It does. It does.
Yeah.
I'll just adjust if I could, I'll just give one example. There was a product that I worked on a couple of years ago, and we added. It's not like we had extra money, but we figured out a way to find it, and we added a grocery benefit under SSBCI to one of our plan designs,
Okay.
and folks thought, oh, that's a great benefit. Everybody would love a grocery benefit. But it was under SSBCI, so it was for certain health conditions. But the reason we needed that was because we had to increase the risk score. And we thought one way would be to attract certain health statuses into our plan. So for instance, if you qualify, you would qualify if you had some cardiac condition, for example. You would get this extra benefit. But you wouldn't if you didn't have cardiac issues. But it was really helpful for compliance to understand the method behind the madness. Where it's not just about throwing pretty cool benefits into a plan design. There's usually a reason to do that.
Good example.
Great example.
Jess, we've got a few slides kind of in this general topic area, and I know
Yeah.
we're coming up tight on time. If we want to advance to the next slide, I'll call out one comment here. And I guess I realized we never actually mentioned that Jackie and I work together at Horizon Blue Cross Blue Shield, but that's the reference point for a lot of what we're talking about. But she's talked about the partnership, and at one point she was the compliance officer. I headed sales and marketing and other things, product. So there was always a good open line of communication between us personally and departmentally. And I understand that's not the norm everywhere. The other thing I would point out, and we did this in the sales and marketing area, and we thought it would be worthy of mentioning here, is once I got over the notion in my head that internal audit was the enemy, I actually kind of embraced internal audit, because what I realized when I got into the Medicare Advantage world was I would rather have internal audit find it than CMS.
Yeah.
And so every year we would sit down and with internal audit in advance of the year, map out the 2 or 3 things we wanted them to focus on. Could have been sales quality, it could have been commission payments, could have been any number of things. Lord knows there's enough for them to look at. And so we went into the year with a plan, and they gave us the output. We operationalized their improvements that they found, and this became we were the lone testimonial for internal audit. They tried to publish a highlight every year, and we were the only department that would actually talk about what a great relationship we had. But again, even if you just want to take the most practical view of it, better we find it than CMS finds it. That would be my takeaway there, for sure. And
Yeah.
And then on the next slide, we talk again about the relationship between sales and marketing, but we make the point here in a matrixed organization, which most are, that program management, right? How you manage your Medicare Advantage business, particularly when it's not the only thing you do, right? If you're a commercial plan in particular, there is an accountability model here. I hate to simplify it because it's not this easy as saying it's a racy chart, but there is an accountability model that needs to have line of sight throughout the organization, built into incentives, built into department goals. We've actually got some slides on this I could de-identify and share if anybody was interested, just to kind of see the sort of the checklist we suggest. But that's the one comment. And then Jackie, maybe you want to talk about the communications review process.
Sure. Many years ago, I learned the hard way that there were certain materials that we would consider to be high-risk materials. And this was back in the day, and think CMS continues to do that. Like, they issue notices of non-compliance if you happen to need to send out an errata sheet for example, your ANOC or your EOC or your formulary. So what we put in place a few years ago when I was on the health plan side is we would identify the materials that we considered were high risk. They're honestly, they would be the same in all plants, or very similar. And we prepared those materials, and they went through an internal quality review, and that included the business and compliance. But it was so important not to receive a notice of noncompliance because we didn't want to be on CMS's radar, that we hired an external entity to review and comment on all of those materials. And so that to me is a best practice. We stopped getting the notices of noncompliance. We didn't have to send out errata sheets. So it's better to, in my opinion, to put the work in up front and provide all that needs to be provided to that external party, whether it's PBPs and information in the bid, information about silly things like accuracy of telephone numbers and addresses and things like that. But it's great to have a second pair of eyes that's a little bit more objective, look at your documents and catch those issues before CMS does.
Absolutely.
That's a great suggestion, Jackie. And we appreciate our partnership with you all and helping us to do that as well.
Yeah.
Yeah.
All right. Liz, do you want to move
Yes.
forward? Go ahead. Go ahead, John.
I was going to say, I mean, I know we're, we're coming up on time, and, I think, I love the fact that WEX is taking the interest and trying to be knowledgeable, but also, help pass things on to your plan clients as well.
Yeah, absolutely. I think this is just a great place to kind of end here. I think we've kind of hit all of the what to avoid between marketing and the marketing outreach. And
Avoid the avoidable mistakes.
yes,
That's the key. Life will be much easier.
Yes.
that was great. Well, appreciate you guys taking the time to chat with me and with the group today. Our intent is to continue to have these conversations for the health plans out there. I think we had hoped that we would have a final rule when we put this on the calendar to discuss, but given that we didn't, I think the information you shared was very practical. I think it definitely can help the plans look at how they want to put their bids together for 2026, and kind of what we are looking to anticipate moving forward. So appreciate everybody's time today. Again, I will be sending out the recording as well as the slides, and certainly reach out. I think we had a few questions that came up, the one that we will respond to afterwards. And with that, appreciate everybody's time, and we can close our webinar.
Thank you,
Thanks,
Jessica. And
Jessica.
I see your
Thanks,
question,
Dave.
Angie. We'll work with Jessica to get that out. Okay.
Great.
Bye, everyone.
Bye, everyone. Thank you.